Welcome back. In today's video, I want to talk just a little bit about some of the discussion that I've seen on a couple of my previous YouTube posts with regard to the insurance industry and how the charges of certain procedures relate to, the providers and the patients and insurance and all that jazz. This isn't meant to be disparaging in any way, shape, or form. What I want to comment on is my experience as it relates to dental insurance and other financial question marks. So we live in a capitalist society. So naturally, there's going to be a financial value attached to most services and products. Dentistry and medicine is really no different. There's always a financial cost to everything that happens. One of the challenges that we experience as providers is helping patients understand that we are not necessarily the ones that are contracting with the amount that you as a patient is going to pay. So let's take, for instance, George that comes into the office and may need some sort of a dental procedure, whether it's gum treatment, whether it's a crown. Ultimately, they have their insurance and they have, a fee schedule from their insurance, and so they bring it to me and say, here's what my insurance says it will pay you, me as the provider, for procedure X, Y, or Z. And so now we have to discuss what it's going to cost the patient out of pocket. In dentistry, we have what's called a UCR fee, which is a usual, customary, and reasonable fee, UCR. That's the standard fee, the cash price, if you will, for the procedure. And then there's the insurance fee, which for any given insurance company may be dictated to be much lower, might be dictated to be about the same as our cash price fee, depending on your insurance company. And on the other hand, it might be something that is totally different. But the challenge we now have is, me as a dentist, I prescribe and recommend treatment based on what I see, what the need is for that individual patient. And so if I go in and begin to adjust my treatment recommendations based on what the insurance will pay or based on the patient's out-of-pocket expense, then I'm allowing the insurance or the financial implications to now shadow or color or taint my prescriptive recommendations for treatment. And that's a very slippery slope. Now, there's this thing called a slippery slope fallacy, which I understand. But the challenge now is, are we going to allow the providers that have a specific set of training within dental school or medical school or whatever it is that you went to, are we going to allow the cost of the procedure now to dictate what we prescribe to our patients? We have to be very cautious with how this works and very sensitive to the patient's needs. This, unfortunately or fortunately, depending on your perspective, is how our society functions right now. You come to me as a dentist, I prescribe a crown because you have a cracked tooth and a large cavity with a failing filling. Here's the cost. Our crown fee is $1,300 plus the cost of core buildup, which is $300 some odd dollars. Your insurance may dictate a lower fee, which is all based on an arrangement you have with your insurance company that I've agreed to whatever, to charge out or discount or write off. But ultimately, you still need that treatment, regardless of the cost. We sometimes get in the habit of, and maybe this is a front office challenge more than a back office, business office challenge more than a clinical challenge. We sometimes get in the habit of recommending one crown choice, material choice versus another because one is cheaper for the patient. Now, in some situations, that may be fine. That may be a great opportunity to save the patient some money. On the other side of that equation, though, maybe one crown material choice is much better than another crown choice, and there's a reason for that. And that should come down to the clinician's recommendation based on what's in the best interest of the patient. So it's a balance that we have to strike. In a perfect world, we all would get the dental treatment and medical treatment that we need. It would be reasonably priced, and we would easily be able to pay for that. The challenge that we have now, though, is we don't live in a perfect world, and there are so many factors involved. One of the, discussion points in the previous YouTube video that I saw, or that I made, and the comments that were, there's a kind of a comment string that you can read through. Why does a crown cost so much? For me as a clinician, it takes 2.5 hours, depending on the time, to execute a crown procedure for a patient. Sometimes it's much faster. I think we delivered a crown and a root canal in about an hour and 15 minutes, start to finish, last week. But sometimes it takes some time. So why does it cost so much? Well, we have contracted fees, and they're not just, if you came in as a cash patient without insurance, the fees that I can charge are not just related to, the fee that I agree with you, but also I have these contracts that I've signed with a bunch of other insurance companies so that I have to charge a certain fee for any given procedure. And I can't discount it for a cash paying patient. So we're locked into these many agreements. And in return for me signing an agreement to charge a certain amount for a crown or a root canal or whatever procedure it is, they agree to put me on a list that now patients will be referred to. So there's a quid pro quo there, and we have to balance that very cautiously. I would love to get to the point, maybe this is every dentist's dream, to get to the point where insurance is not a factor in anything that we have to worry about. Our patients are independently wealthy and can pay our cash prices, and then I don't have to run around and see 400 patients a day, not 430 or 40 patients a day, because the fees that I'm charging are allowing me to meet my office needs, my staffing needs financially, and allowing me the income that I need to cover my student loans and expenses, et cetera, without having to see 400 patients a day. But now the challenge falls down to balancing this. If I have a patient who's a cash patient, how do I make sure that they can get the treatment that they need at a reasonable rate? And so enter the insurance companies. And there's a distinct difference between medical and dental insurance that we have to watch out for. And I'm not an insurance expert. I know that generally speaking, insurance companies seem to be more of a barrier to getting dental treatment than they are pushing patients to get treatment. It almost always acts as a barrier to allowing patients to get treatment. If we didn't have the insurance companies in place, potentially there could be a much easier process. If you take the amount that the patient has paid into their dental insurance and just put it in a savings account, and then when they come into the dental office and they've got X amount of dollars that they've accumulated over several months, it makes it a little bit simpler to start treatment. So, but of course the insurance companies have to answer to shareholders, and I don't blame them for doing so. The insurance company's purpose is to generate revenue for the shareholders of the company. And if I was a shareholder, I would expect the same thing. So we come down to that middle ground, that gray area in the middle, where an insurance company is in a de facto way prescribing treatment for patients based on cost. So insurance company agrees to pay X amount of dollars for this procedure, but they'll pay a cheaper amount for this procedure or a better reimbursement rate for the patient. So that leads patients to go in one direction, which may not necessarily be in their best interest. And we as clinicians are caught in the middle of that. I have an agreement with an insurance company to charge a certain fee. That fee is based on a signed document, a contract, which I cannot vary from. The insurance company itself has an agreement with the patient's, usually the employer. The responsible party's employer is where the insurance comes from. And so I have to balance that. The fee that I'm charging you is based on a negotiation between your responsible party, whether that's you as a patient or whether that's your husband, your wife, whoever it is, and the insurance company, the employer and the insurance company. That doesn't have anything to do with me. So here's the price, take it or leave it, moving forward. Now we have some discount plans and we do have some payment options which make it a little bit easier, but it's always a challenge. When you hear in different countries and different places that it's whether it's nationalized healthcare or whether the cost of the treatment is much less, this is not to be a commentary on quality of care. That's not what I'm saying. But the cost of treatment is less. It's much easier to get in to get treatment. So there's a very challenging balance that needs to be struck with regard to cost of treatment and prescribing appropriate care. We as clinicians draw a line in the sand, or should draw a line in the sand, and it should be a series of decisions based on very clear indicators, whether it's tooth has a cavity or fracture, or gum disease indicators like bone loss and probing depth. recommending treatment that's in the patient's best interest, period, end of story. And we should, in my opinion, never be involved in the financial question marks. In dentistry, though, many of us run our own shop, if you will, and so we have to see those numbers. But it would be much easier if I could prescribe treatment at a distance from the cost of that care, because it devalues my prescription, in my opinion, if I know how much the treatment is going to cost. Does that make sense? If I know how much the treatment's going to cost, sometimes, out of an abundance of concern for the patient's welfare, whether it's pocketbook or otherwise, sometimes I am more apt to suggest treatment that's less expensive, which may not be in the best interest of the patient. So we have to walk that line. We have to balance it. We have to stay well within clinical protocols as far as acceptable standards of care, while being sensitive to the patient's financial needs, and at the same time considering, it takes a huge amount of money to keep a dental office open. The break-even point for many dental offices is well over $100,000 a month. And depending on the size of the dental office, it could be significantly more than that just to break even, to pay the bills. And if we don't have a certain amount of procedures happening in the office at any given time, any given month, then the cash flow turns negative, and that cannot be supported for very long for many offices. And that's why we saw, some offices closed during COVID and during other challenges. I've been through an office upheaval years ago, but we have to balance that. And it's important that we consider being very cautious and balancing what's in the patient's best interest clinically with what's in their best interest financially. And sometimes those two do not align. And sometimes we have to find a way to fit the dentistry they want and need into their budget. And it can be a challenge. Anyway, so those are my thoughts for the day. 12 minutes going on, 12 minutes here. Hopefully this has been helpful. To recap, we prescribe treatment based on what's in the best interest of the patient, but we have to consider the financial implications of that treatment from a distance, being cautious that we don't take advantage of patients in any way, shape, or form. And with the way our society is set up, the capitalist society, unfortunately, everything we do in dentistry and medicine has a financial value attached to it that we have to be cognizant of. So please ping me, email me, text me if you have my number. Respond to this, comment what other additional data you'd like. I'd be interested in hearing your comments about what I've just stated. Hopefully this has been helpful. Sometimes there's a lot of cobwebs rolling around in here, but please let me know what other questions you have, and thanks for watching.